America's healthcare debate usually focuses on cost, access, or politics, but hidden behind these headlines is a deeper issue, one that quietly disrupts every part of the system. We don't have a secure, universal digital healthcare identity for every US citizen. And that's not just a policy oversight, it's a critical IT problem. Hospitals rely on names, birth dates, and addresses to match patient records. But names change, addresses are temporary, and babies don't always get named right away. These aren't just administrative errors, they're gaps that put patient safety at risk. Duplicate records and mismatches can lead to medication errors, treatment delays, or even misdiagnoses. These problems are not rare, they happen every day. The Social Security number was never meant to be a universal medical ID. It was meant to track a worker's earnings over their lifetime to determine federal benefits. It's now a primary target for identity theft, not just because it was used to identify people receiving healthcare, but because banks and financial institutions appropriated it as a key form of identity verification. Additionally, credit agencies use it as a primary identification method to determine a person's credit rating. This rating determines what a person is able to borrow and at what interest rate. This means that compromising a person's Social Security number can put their financial security at risk. Because of this financial risk, regulations changed and Social Security number was no longer a required field in most medical forms. But there's no better nationwide alternative. As breaches increase, patient trust decreases. People hesitate to share critical information not out of paranoia but from valid concerns. Each state manages its own healthcare data and they rarely share it. Not because they don't want to, but because they can't. Even if every state and the federal government agreed today to share all health data, there's no practical way to link it. We can't reliably identify individuals within a single state, let alone across state lines. As a result, we're spending billions of dollars building patient-matching algorithms just to guess who's who. But all of that would be unnecessary if we simply had a secure, universal digital healthcare identity. If you move from Arizona to Florida, your new doctor may have no idea what tests you've had, what medications you're on, or even if you're vaccinated. This fragmentation also enables prescription abuse. A patient can get opioids in one state, then cross into another and get them again. No alerts, no red flags. Even well-meaning doctors can't see the full picture. There is no nationwide system that ties prescriptions to individuals across all states. Some pharma companies track supply chain data, but not patient-level outcomes. Without a secure digital healthcare identity, we don't truly know what's happening inside our health system. Are vaccines effective? Do certain medications affect specific groups differently? Are there cancer clusters near certain geographic areas? We can't answer these questions at scale because our data isn't connected. Public health officials are forced to make decisions based on incomplete, outdated, or unlinked data. That's not just inefficient, it's dangerous. This isn't about politics, it's about infrastructure. Healthcare runs on data, and data depends on identity. Without it, everything else breaks. A modern, secure digital healthcare identity would let patients move freely between states and providers. It would allow real-time insights, safer prescriptions, and faster treatment decisions. With the right design, patients stay in control. Access is tracked, encrypted, and permission-based. And critically, it should never be allowed to be used for financial or commercial purposes. That's how we protect privacy and earn public trust. With a secure digital healthcare identity, we can reduce errors, cut costs, and finally modernize healthcare to match the rest of the digital world. This is the healthcare crisis no one talks about. It's time to fix the foundation of healthcare. Let's start with a federally provided, unique healthcare identity. There will be more videos in this series. But if you'd like to dive deeper into the topic right now, visit the link in the description of this video and read all the blogs related to this idea.